Number 5. Which drug is most likely responsible for the occurrence of hypothermia and muscle rigidity in a patient undergoing surgery while being administered anesthesia with halothane? Your options are. And the correct answer is suxamethonium. Here's the explanation.
The most common side effect, my homework you have to remember, it is muscle soreness. The second most common side effect is hyperkalemia. The third side effect of scoline use is right is bradycardia. Scoline can cause bradycardia. Just it causes bradycardia. Apart from that, all the things it will increase. It will increase the intracranial pressure, intraocular pressure, and also the BP. Coming to the most dreadful side effects of scoline. Okay, guys, we are discussing about the side effects of scoline. Right? Coming to the most dreadful side effect. The most dreadful side effect of scoline use is called as malignant hyperthermia. Malignant hyperthermia. What is meant by malignant hyperthermia? This is very, very important topic, guys. As you go with the name, you can understand. Malignant hyperthermia is abnormally high temperature with sustained muscle contraction. That is called as malignant hyperthermia. Abnormally high temperature with sustained MR. Okay. Now, why does choline cause malignant hyperthermia? And does choline cause malignant hyperthermia in all patients? Does it cause in all patients? No. Choline will cause malignant hyperthermia in autosomal dominant patient. Right? So whenever you give choline to an autosomal dominant patient, what is happening? These patients will have a receptor called as abnormal ryanodine receptor. What will choline do? Choline goes towards this abnormal ryanodine receptor. Imagine this is the receptor. Okay? And if we give choline to an autosomal dominant patient, this choline goes towards the abnormal ryanodine receptor, stimulates this receptor. As this receptor is stimulated, it will release calcium. It will release calcium. And that calcium causes severe muscle contraction. Severe muscle contraction. And this muscle contraction starts with what muscle? It starts with the masseter muscle. Thereby, whole body gets involved. The first muscles to be contract over here is masseter muscle. Okay. So this is regarding the malignant hyperthermia. It stimulates the abnormal ryanodine receptors in autosomal dominant patient to release calcium that leads to sustained muscle contraction that starts in the masseter muscle. Thereby, the whole body gets involved. Now, guys, if at all malignant hyperthermia is encountered during the case, what are the clinical features that you see in the patient? You will see the temperature is abnormally high. Apart from the temperature high, as the muscles are contracting, the respiratory muscles of the patient gets contracted, leading to what, guys? Leading to acidosis, respiratory acidosis. The patient might have pulmonary edema. If not managed properly, the patient can land up into DIC. What is DIC? Disseminated intravascular coagulation. Disseminated intravascular coagulation. Okay. Now, guys, these are the clinical features of malignant hyperthermia. Right?
Question number 6. What could be the probable reason for the observed result in the capnograph of a patient who is intubated and undergoing controlled ventilation? Your options are. And the correct answer is spontaneous respiratory effort. Here's the explanation.
Imagine you have intubated a person. The capnograph reading was absolutely going normal, right? Normal. After 20 to 30 minutes, what you see in this capnograph reading is there is a curare notch developing. there is a notch developing over here. What does it mean? And it is continuing. First we had first 30 minutes, nothing happened. After that, there was a curar notch developing. Remember, I'm talking about this curar notch. Why is it developing? Right? Remember, guys, this is the exhale phase. This is the plateau. In between the plateau, there is one spontaneous breath coming. That curar notch is due to the spontaneous breath. I told you in the start of the case, we gave the muscle relaxant. Hence, the patient muscles were relaxed. Patient was not at all. There was no effort from the patient, and you were getting this kind of capnograph. But as the case progressed, what happened? The patient slowly developed a spontaneous breathing. Return of spontaneous breathing. Curar notch indicates return of spontaneous breathing. It indicates return of spontaneous breathing. This curar notch indicates the return of spontaneous breathing. There was an MCQ asking that you see a curar notch developing during the case. What is the next step? What is the next step, guys? That means the patient's spontaneous breathing has returned. What will you do? If the surgeon is telling that more half an hour, I want more half an hour, it will take me for finishing the surgery. What's the next step, guys? The next step is, come on, guys. The next step is what? You give muscle relaxation. You give a muscle relaxant.